What is endometriosis?
Endometriosis is a pathologic condition in ladies. It's a gynecological problem which is implantation of endometrial tissue outside the uterine cavity. Maybe it is in the pelvis, in the peritoneum, in the ovarian fossa, or it is in the myometrial tissue, or maybe it is also on the ovary, which is causing a condition which is called endometrioma or chocolate cyst. The incidence is approximately 15% to 20% of our gynecological problem is because of this endometriosis. It happens during reproductive age. It starts from age 17 to age approximately 38, 36. It is an estrogen dependent condition. It's because of the too much estrogen in the body of the woman this happens.
What are the symptoms of endometriosis?
Major symptom patient, they will have pain. Patient who has got a mild disease, because these are different stages, stage 1, stage 2, stage 3, stage 4. If they have stage 1 and stage 2, they have lots of pain. It's because of the lots of immunological factors, cytokines, macrophages, and all interlocking. It causes a lot of inflammation in the pelvis, which is causing painful menstruation, pain in the pelvis, pain in the lower abdomen, pain during the intercourse, dyspareunia, dysmenorrhea, all these, and also it causes infertility. The patients, 30-40% of patients with endometriosis, they are suffering from infertility. They cannot get conceived.
Role of laparoscopy in the treatment of endometriosis.
Laparoscopy, it is a very important way of investigating these patients who are having infertility plus endometriosis. It is to diagnose, to basically confirm the diagnosis whether she has endometriosis or not. And it's age related. If patient is married for about 10 years and she's been not getting conceived, the HSG has shown a patent tube, there is no male factor, there are no other problems, so then we have to suspect endometriosis. Or the second indication for doing a laparoscopy, if it is an unbearable pain, where this pain does not get relieved with any painkiller or with any other medication, then we have to consider laparoscopy. The third indication for doing a laparoscopy in this patient with endometriosis is the presence of a chocolate cyst, endometrioma, which can be diagnosed on the ultrasound. And these endometrioma and chocolate cyst, if it is the size is more than 5 to 6 centimeters, this is a very strong indication to do laparoscopy.
How long does it take to recover from laparoscopic surgery for endometriosis?
I've been happy if you just asked me what is the success rate of the laparoscopy with infertility. But I will answer your first question where you're asking how much is the recovery time. It is not more than a week. Not more than a week. You see, it depends on the stage of the stage of the disease, stage of the endometriosis. If patient is in early stage, she will get success, maybe with couple of IUI or maybe in a natural ovulation induction. But if it is in a severe case, then in a stage 3, maybe she would need to go after the laparoscopy for kind of a ART, ICSI treatment. And in a stage 4, then it's still more complicated. Then maybe sometimes if they are very resistant to ART and laparoscopy, and you have to do pre-AIVF and ART treatment like LHRH agonist depot, we have to give 3-4 cycles. And still if they are very resistant for the treatment in spite of ICSI, she does not respond, then she has to go for the third party treatment. Third party treatment, some other occasion I will explain what is third party treatment.
Success story.
There are cases where they are success. There are cases where success with ART. There are cases where success with the IUI, but the interesting cases are there where they had several times IVF failure and no success, and they came here and we have done a segmented IVF a lot better than doing a conventional IVF, because segmented IVF, once we have done a COS and we have taken all the egg and ovum pickup, then we have to do for the IVF and the blastocyst culture, and we do the vitrification of the blastocyst. And in about 3-4 months, sometimes 5 months, once we have given a LHRH depot and we have to just prepare the endometrium with the HRT, then their success is very good.